If you know you want implants for breast reconstruction, should you do it in one stage with direct to implant versus tissue expander? There's things to consider, which are your choice, and then there's characteristics of the cancer which can kind of sway you or make you do one thing. So if you do direct to implant, remember, you're not going to have a lot of freedom over what size your breast is going to be. It's just going to be whatever fits. And this depends on the incision choice, whether it's a nipple sparing or a wise pattern, whether or not you'll be the same-ish size or smaller. But if you want to be significantly bigger, direct to implant's not a good option. Also, if you need a skin-sparing mastectomy where a lot of skin's going to be removed and you want to retain your breast size, direct to implant, not a good option. Tissue expander can be a great option if you want to increase your breast size or if you need a skin sparing and want to regain your breast size. So remember, it's thinking about what's providing the volume and then what's covering it. Now, I've had a reel before about how I will die on this hill, but I firmly believe that if you're going to have radiation, you should try to place the implant before radiation. But I know not all plastic surgeons agree with me, and that's fine. There's evidence to support both ways. Studies show that about 50% of patients who have direct to implant will still have some type of elective revision procedure. That could be mesh placement, different implant, maybe the implant was malpositioned, needed to be fixed. But part of the reason why I love direct implant is still that means that 50% of patients had the reconstruction or done. They had that surgery, and then for 8 to 12 years until that implant needed to be replaced, they were good. I love that. Here's what I tell patients. If you want to try to do this in one stage, let's do it, as long as they're a good candidate based on everything else I just said. But if they want full control over their size, if they want to look down and be like, yes, this is it, then you got to do a 2-stage. You got to have that tissue expansion in clinic that you then approve prior to doing the 2nd stage. I love direct to implant, but I would love to hear what your thoughts are if you had 1 stage, 2 stage, and what you wish you knew before your surgery.